Peace everybody, back with another video. This is why scientists are changing their minds and disagreeing during the C-19 virus pandemic. Alright, as you can see here in the picture is U.S. Surgeon General Jerome Adams, who is holding a mask in his hands right now. And we're going to find out why scientists are changing their minds and disagreeing about these masks. U.S. Surgeon General Jerome Adams holds a face mask during the daily briefing on the novel C-19 virus, which causes C-19 in the Brady briefing room of the White House on April 22nd, 2020 in Washington, D.C. So that's when this was, this is when that was held. All right. If you turned into the daily news cycle during the C-19 virus pandemic, you probably noticed circumstances where scientists seemed reluctant to share information, debated the latest research on social media, or downright changed their views. Yes, so if you tuned into the daily news cycle during, which I don't, because I don't watch the news, it's all fraudulent. During the C-19 pandemic, you probably noticed circumstances where scientists seem reluctant to share their information. All right, so now they are reluctant about it. In our culture, we often hold politicians, corporate executives, and other leaders accountable for the consistency of their positions in political debates. Candidates will often point out on the debate stage that a rival swung to the left or right over a controversial issue. It suggests a lack of authenticity or even careerism, and indicates that they can't be trusted to do what's right for their own constitutions. Yes, so they can't even do what's right for their own self. So this is why we're getting blamed for everything. The culture, we often hold politicians, corporate executives, and other leaders accountable, which is a good idea. Hold them accountable. It is a good idea. For the consistency of their positions in political debates, candidates will often point out on the debate stage that a rival swung to the left or to the right over a controversial issue. All right, so then they have it. It also says it suggests a lack of authenticity or even careerism. All right, so that's what it has. In the scientific world, it's expected that even the highest ranking academics will evolve their thinking, and many have done so during the C-19 virus pandemic. Yes, so in the scientific world, it is expected that even the highest ranking academics will evolve their thinking. So they have to evolve their thinking about what they want, while everybody else is suffering. And so this is why with these academics, it is a good idea to evolve their thinking. But some scientists fear that the public doesn't understand this and is losing faith in scientists who change their minds, and that's having real consequences on the front lines. Yeah, so people are losing their faith in the scientists, which is fine with me, because the fake scientists, they're misleading you. They're telling you, oh, you got to do this, do that, blah, blah, blah. No, you don't have to listen to the misleading scientists. They're not real. They're full of garbage, and everything else. All right, but some scientists fear that the public doesn't understand this and is losing faith in scientists who change their minds. Well, yeah, people are going to be losing their faith in science because of all the garbage that is going on. Well, they're making up everything as they go along. Well, you got to do this, you got to do that, blah 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 blah. No. Dr. Megan Rainey, an emergency physician who works at the Rhode Island hospital, said some patients are coming into her emergency department refusing to wear masks. When she prompted them to wear one, they often told her that public health authorities like the World Health Organization and the CDC initially advised against wearing masks, saying there was little evidence that it would help prevent people from getting sick. So yeah, that's what it is. So this is what Dr. Megan Rainey, who is an emergency physician, she works at a Rhode Island hospital, says some patients are coming into her emergency department refusing to wear masks. Well, can you blame them? They have a right to not to wear them. It's their choice. They cannot make you. It's your choice if you want to or not. Then it goes on, when she prompted them to wear one, they often told her that public health authorities like the World Health Organization and the CDC initially advised against wearing masks, saying there was little evidence that it would help prevent people from getting sick. So there's very, very little evidence that it will help help prevent people from getting sick. So obviously there's not really that much evidence, but maybe a fraction of it, a very little of it. The recommendation later changed as studies began to show evidence that people with no symptoms might be spreading the disease. Now both organizations encourage all people in public to wear masks, including cloth-based coverings, to prevent the disease from spreading, exactly what citizens in some countries like Hong Kong and Japan had guessed during the early days of the pandemic based on past experience. So now, later on, the recommendation had changed as studies began to show evidence that people with no symptoms might be spreading the disease. Excuse me, how are people with no symptoms spreading the disease? I like to hear this one. Now both organizations encourage all people in public to wear masks. No, we don't have to. When I go out, I don't wear one. Am I spreading a disease? No, because I'm not sick. I'm healthy as ever. The only time I get a common cold is twice a year, spring and fall. Common cold. That's all I get twice a year. And now they're saying including cloth-based coverings to prevent the disease from spreading. Exactly what citizens in some countries like Hong Kong and Japan. Well, Hong Kong and Japan, well, they're under mind control. I might as well say it. Mind control. They have to do whatever they are told. Here in America, you don't have to listen to it. Japan had guessed during the early days of the pandemic based on past experience. What past experience are they talking about? What, the SARS, the influenza? Is that what they want to know about? But as Rainey pointed out in the interview with CNBC, it's part of the process that leading public health authorities would adapt their thinking based on new information. Of course, CNBC will be twisting everything around, all up and down, here and there, and I don't know. It's like a wormhole they're going through. As part of the process, their leading public health authorities would adapt their thinking based on new information. Of course, people would have to think for themselves, because if they don't, then you're going to be stuck in that system forever. Me, I don't listen to nobody. I don't need to, because nobody controls me. I do not bow down to these crooked people. I only bow down to God. So that's all I bow down to. Carl Bergstrom, a biology professor of the University of Washington and an author of a book about misinformation, explained that very little was known about the virus back in January and February. So, infectious disease specialists and epidemiologists had to do their best without much data at their fingertips. So there is a book called Misinformation. It explains that very little was known about the virus back in January and February of this year. So there was very little about it. So infectious disease specialists and epidemiologists had to do their best without much data at their fingertips. So they had to do whatever they could about the data at their fingertips. So even today, notes Dr. Bergstrom, there isn't always a clear answer on important metrics like the case fatality rate. Dr. Bergstrom provided a range when asked about that and not an exact percentage. Sometimes the only response is it depends, or the even less satisfying. We're still figuring that out. That can be difficult to hear when the public is searching for answers and policymakers are looking for clear advice to pass on to their constituents. So Dr. Bergstrom takes notes, and obviously there isn't always a clear answer on important metrics like the case fatality rate. Alright, so there's not very much about it. There isn't always a clear answer on important metrics like the case fatality rate, because the case fatality rate is all over the place. You don't know which one to believe. So is it this one or is it this one? You don't know which one to believe. Dr. Bergstrom also provided a range when asked about that and not an exact percentage. So there's no exact percentage of anything. You don't know what to believe. Sometimes the only response is it depends, or even the less satisfying. We're still figuring that out. And yes, they are still figuring that out. Is it this one or is it this one? It all depends. When you take a completely novel virus, you are starting out from a position by default knowing nothing. Dr. Bergstrom explained. You can at best make guesses based on what you know about previous C-19 virus or the C-19 virus and prior outbreaks of other respiratory viruses. So that's all it is. It's just a respiratory virus. It's nothing serious or anything like that. When you take a completely novel virus, you are starting out from a position of by default, knowing nothing. So it's a default. That's all it is. It's nothing serious or anything like that. That's all it is, a default. As a pandemic progresses, scientists will get more data as more cases occur. That gives us more time to do basic investigation into the molecular biology of the viruses and the interaction between the virus and host, he explained. You get more opportunity to watch how transmission works, and you come up with new conclusions, based on more evidence, and then you make those public because it's the best of what you know. Alright, so as the pandemic progresses, scientists will get more data as more cases occur. So they'll get the data, but that doesn't mean it's always going to be accurate, because it could change here, there, and everywhere. That gives us more time to do basic investigation into the molecular biology of the virus and the interaction between the virus and host. So that means we are the host for the viruses. The viruses cannot live outside of the body, because it has to cling on to something inside you. So this is why the virus is not be able to live outside of without a host. And this is what he explained about that. But you get more opportunity to watch how transmission works, and you come up with new conclusions based on more evidence, and then you make those public because it's the best of what you know. Yes, so what you know is what you know. You cannot go by what anybody says really too much, because you never know where the data is. Is it over this way or is it over this way? You don't know which way the data is. Others in the community say that it's even a badge of honor for a scientist to up their thinking when confronted with new evidence. Vinay praised a hematologist, oncologist, and associate professor of medicine at the University of California, San Francisco, said that best scientists are continually re-evaluating themselves to see what we got right and what we got wrong. Yeah, well, you have to fix what's right, you have to fix what's wrong. More likely, they're going to have to fix everything what's wrong, because the numbers were jacking up all over the place. It's like, wait a minute, are you sure this is the right numbers, or is this the right numbers? You don't know which one it is. Others in the community say that it's even a badge of honor for scientists to update their thinking. Yes, so they have to update their thinking when confronted with new evidence. So when somebody shows them new evidence, they have to update their thinking and figure out what's what. As he put it, it's a high mark to be able to say, I'm going to change my mind. Yes, so that's what you can do. You could simply say, you know what, I'm going to change my mind. I'm not going to wear a mask. Nobody can make me. So you have a right to change your own mind. With the situation moving so quickly, scientists are rushing to publish papers before they're peer-reviewed. Those papers are increasingly getting picked apart on social media by communities of their peers, a process that previously would have happened behind closed doors. Yeah, so with the situation moving so quickly, scientists are rushing to publish papers. All right, so they're writing papers. This is what they do before they're peer-reviewed. Those papers are increasingly getting picked apart on social media. Well, can you blame them? By communities of their peers, a process that previously would have happened behind closed doors. Well, you know, people on social media are picking apart those papers because they know that the numbers are all over the place and nothing is accurate. It's like, okay, is this many people dead or is this many people dead? Which one is it? You don't know which one to believe. This is why they're getting picked apart on social media. The so-called preprint servers like BioRxiv and MedRxiv feature research that is disseminated far more rapidly than the usual peer review process, which can take weeks or months. Consumers are now witness to these discussions and occasional fiery disagreements. So so the preprint servers like BioRxiv and MedRxiv feature research that is just mandated far more rapidly than the usual peer review process. Alright, so they're getting picked apart all over the place. Consumers are now witness to these discussions and occasional fiery disagreements. So you got consumers that will witness all this stuff and everything else. One particularly not noteworthy debate during this pandemic concerned a group of academics, including Dr. John Lowndes at Stanford University, who have consistently argued there is a lack of evidence to support shelter-in-place orders. That same group published research via one of these preprint servers indicating that the virus might be more prevalent than initially believed and therefore potentially less deadly. So so the shelter-in-place thing, there's a lack of evidence of that. So there's no way that there's a shelter in place because it's very lacking evidence to support shelter-in-place orders. That same group published research via one of these preprint servers indicating that the virus might be more prevalent than initially believed and therefore potentially less deadly. So it's very less deadly. So it's only 0.001%. That's all it is. Nothing more, nothing less, just right where it's at. 0.001%. That's all it is. It was pillared by other scientists on Twitter and other social media platforms and picked apart for the problematic methodologies. So it was pillared by other scientists, such as Twitter, other social media platforms, and picked apart for the problematic and methodologies. So everything is getting picked apart so far. So people are just looking for answers, what they want to know about the real truth about everything. These discussions used to take place over email or by phone, Bergson said. Sometimes there are just different groups working on the same problem but with a different hypothesis or a different theoretical framework, he added. So if you see scientists arguing, it doesn't necessarily mean that anyone is a bad actor. Oh, well, yeah, that's true. These discussions used to take place over email or by phone. This is what Bergstrom said. Sometimes there are just different groups working on the same problem, but with a different hypothesis or a different theoretical framework. So if you see scientists arguing, it doesn't necessarily mean that anyone is a bad actor. And there's plenty of bad actors around. Praised believers that scientists are right to point out flaws in data or methodology, particularly if the paper has been published in a preprint server or the conclusions that the public are jumping to might be dangerous. But he takes exception with the personal attacks he's seen on social media. So the doctor has been taking personal attacks he's seen on social media. You're wrong about that. Excuse me. Praise believes that scientists are right to point out flaws in data or methodology, particularly if the paper has been published in a preprint server. So they would have to print out the paper, not just writing it, but printing it out as well. For consumers without scientific training, he notes it can be extremely challenging to determine the true experts in a field, especially when a person's credentials appear to be solid. He suggests looking at a researcher's publication history, but recognizes that not everyone has time to do that. So not everyone has time to do that, but consumers without scientific training, he knows it can be extremely challenging to determine the true experts in a field. So that's what he is saying. And of course, he also goes on, especially when a person's credentials appear to be solid. He's also suggesting looking at researchers' publication history, but recognizes that not everyone has time to do that. So not everyone really has time to do it. They're just doing what they can. If you spot scientists disagreeing, he notes, recognize that it's somewhat normal, especially given that the stakes are so high right now. Yes, they are very high right now, the stakes. And of course, he said, if you spot scientists disagreeing, he notes, recognize that it's somewhat normal. So that's all it is. It's somewhat normal that scientists do disagree on some stuff, and some are truthful, but not all of them. The more eyeballs on the paper, the more likely it is to get critiqued, he said. Because of C-19, someone has turned up speed on factory line, and it's not pretty sometimes. So it's not always pretty. So when you gotta have a lot more eyeballs on the paper, the more likely it is to get critiqued. And this is what he is saying. Science is under pressure, and you're seeing how the sausage is made, agreed Bergstrom. So Bergstrom is saying the science is under pressure, and they are, because people want the truthful answer, not given all these fraudulent, misleading numbers here, there, and when it's all over the place, you don't know which numbers to believe. How are you going to figure out which one to believe if they're all over the place? You get like 20 different stories. When the worst of the crisis is over, there will certainly be an opportunity to look back and reflect on some of the mistakes that were made along the way. All right, so when this crazy thing is over, there will certainly be an opportunity to look back and reflect on some of the mistakes that were made along the way. So it all depends on what mistakes they have made. Dr. Prasad said that the scientific community will likely engage in a process of its own to do just that. So they have to fix whatever they gotta fix, and this is what Dr. Prasad said. When the dust settles and we're a couple of years out, I think it will be a useful exercise to evaluate what we got right. Were they the best policy decisions for the evidence that was available at the time? I don't think you get off the hook for views that are totally wrong, he said. So when the dust settles and we're a couple of years out, I think it will be a useful exercise to evaluate what we got right. So they got to fix what they got right and what they got wrong. And it's going to take a lot of time to do all that. So whatever they got wrong, they have to fix it. And whatever they got right, they leave it alone. So that's how it is. Timothy Caulfield, the Canadian professor of law at the University of Alberta, differentiates between cases where a scientist changes their mind based on new data and circumstances where someone misrepresented their work or falsified data. So there was plenty of falsified data there. And this Dr. Timothy Caulfield the Canadian professor of law at the University of Alberta. All right, so he differentiates between cases where scientists changes their mind, and scientists do have a right to change their mind. They could say, "Well, we're going to do this. No, wait, we're going to do this instead." So they can change their mind. If it's an inadvertent error that he explained, the research should retract it with an explanation of the issue, and that should be recirculated to the public. With so much pressure to move quickly, mistakes seem likely to happen, particularly in preprints. So the scientific community and the media need to take great care in how all of this is reported, he said. Yes, so this is what he is saying. If it's an inadvertent error, he explained, the research should retract it with an explanation. And they do need to explain of the issue, and that should be recirculated to the public. So they would have to explain everything about, oh, we missed this, we missed that, oops, these numbers are not right, and these numbers are, oops, we got this wrong, and everything else. He also says, with so much pressure to move quickly, mistakes seem likely to happen, particularly in preprints. So I guess they do have the preprints machines, I'm not sure, but where they print everything. So the scientific community and the media need to take great care on how all of this is reported, he said. Caulfield notes that policy decisions are changing, but that doesn't mean that public health shouldn't be trusted. Oh, well, yeah, you really can't be trusted. It really can't be trusted that much. This is Caulfield notes that policy decisions are changing, but that doesn't mean that public health shouldn't be trusted. I don't know if you, yeah, you have a right not to trust them, but some people do want to trust them. He describes the policy around masks, especially, as a profound communication challenge. So that's what it was. Also, it was a communication challenge. He describes that the policy around masks, especially, as a profound communication challenge. Well, I would not be wearing no mask. Public health sometimes need to adopt positions, even if the evidence isn't robust, he said. And from a policy perspective, those positions need to be championed. Yes, so they need to be championed. Public health sometimes need to adopt positions. And that's what they need to do, is adopt those positions, even if the evidence isn't robust, he said. But that doesn't mean that the scientific community should stop talking about the evidence, he added. You don't want to discourage open, honest debate. So you don't want to discourage open, honest debate, but that doesn't mean that the scientific community should stop talking about the evidence. So the more evidence they want to find, the more they want to try and get it out to people. But it's not easy with the numbers being all over the place. Oh, well, we got this number here. Oh, wait a minute, we got this number here. So which one do we believe? Oh, and you don't know which one to believe because it's all over the place. And it's like, okay, we don't know which one they want us to believe or anything. So this is why it's all over the place. So you never know what to believe anymore. Leave your comments below. I am out.